We have been responded to a 27-year-old female who is 38 weeks pregnant and believes that she is in labour. We're going to enter the scene with our defib and our first response kit. We're also going to grab our baby come now kit out of the truck, which contains a Haskin bag, 2 clamps, scalpel, combine dressings, and a bluey. We're also going to want to bring a lot of linen with us and all of our resus gear, including our oxygen and suction. We're going to firstly assess the scene for dangers. We're going to make sure all the pets are put away, that we're going to be assessing for access and egress to the house. Ali and I have got our PPE on, which is our glasses and our gloves, so I'm happy for us to enter the scene. Hi there.
Hi.
I'm Sarah and this is Ali. We're here to help you today. What's your name?
I'm Georgina.
You're Georgina, all right. And what seems to be going on today?
Baby's coming.
Baby's coming, all right. How far along in your pregnancy are you?
38 weeks and 4 days.
Okay,
Correct?
yeah. And do you know your exact due date or no?
No.
That's fine. How many pregnancies have you had in the past?
One. And this is my second.
Your second pregnancy. And how did your last pregnancy go?
Good.
Healthy baby?
Healthy baby boy.
Okay, awesome. So you just had the one child?
Yep.
All right. And has your water broken?
I think it has,
I
yeah.
think it has. And do you know what it looked like, the fluid that came out?
Strawberry colour.
Straw. And when do you reckon that it broke? How long ago?
Probably 20 minutes ago.
20 minutes ago. Okay. I'll just note that down. And what about, did you feel any mucus come out at all?
Yeah, it was like snot
Looked like
colour-ish.
snot. All right. Do you have a midwife?
Yeah, she's on her way.
She's
She's
on.
been contracted.
Okay. Do you know how far away she is?
I think she said she's 20 minutes.
20 minutes.
Traffic's really bad at the moment.
Mm-hmm. And have you had any complications with this pregnancy at all?
No.
So when was your last scan?
Last month?
Okay. And how was baby looking?
Good.
Perfect. And the positioning was good?
Yeah, she's
Baby was
facing down.
facing down. So you've been very healthy. Baby's been healthy.
Yeah.
And when did you last feel baby move?
Just a couple minutes ago, just a little kick, but
Okay.
yeah.
All right. And do you have a birth plan at all?
I did want to go to hospital, but if it has to come now,
That's fine.
that's okay.
All right. And with your contractions, out of 10, what would you say your pain's like?
Almost to a 10, probably would say 9.
Okay. And would you want any pain relief for that? We have this little green whistle that we can give you, but it hasn't been tested on pregnancies.
Oh, I think I'll pass that.
Okay, that's fine. And with your contractions, when was your last contraction?
Probably 4 minutes ago, isn't it?
4 months.
Yeah.
And how long are your contractions lasting?
30 seconds roughly.
And how long are they apart?
Probably roughly 4 to 5 minutes.
Okay. And do you have the urge to push at all at the moment?
Not yet.
All right. So I'm just going to ask you a couple of questions, George. But whilst I'm doing that, Ali, could you please start taking some vital signs, notably a blood pressure and heart rate? George. Okay?
Yep.
So George, do you have a support person that you want to be here with you?
Yeah, I've contacted my husband. But,
Okay. And
he's
how
on the
far away is he?
He's just talking to his boss now, and
All
he
right.
said he'll be on his way.
Okay, that's fine. And your midwife's on the way as well.
Yep.
So cool. And with your pain relief, I know I've already asked you about this before. Are you sure you don't want any pain relief?
I think I'm fine.
Okay. And you've been well recently? You haven't been to hospital for anything other than the baby?
Yeah, not other than ultrasounds.
Okay. And are you in the most comfortable position for you? So I can move you if you like.
No, yeah, I think I'm comfortable.
You're very comfortable. Awesome. All right. Once Ali's taken some of those vitals, so we'll see how you're doing. And we might just bring your husband and your midwife again and just get a little update on where they might be at.
So blood pressure is 130 over 90 and heart rate is 100. I'm just going to do a temperature quickly as well.
Oh, those vital signs are looking really good, George, so I'm not too concerned at all.
So temperature is 36
Awesome.
and rest rate is 20.
Cool. Happy with that. Right, so George, I've noticed you're in a bit of pain. Do you think those contractions are getting much worse?
I think he's starting up again.
Do you feel the urge to push?
I think so.
All right. Ali, can I just get you to get the mum and baby resuscitated
Yeah,
out just
sure.
in case? Don't be alarmed by this. It's just precautionary, all right? So is it all right if I just have a look?
Yeah.
Okay, cool. All right. I can see that there might be a little bit of fluid and things coming out, so I'm just going to cover you back up, and I'm just going to start setting up my BBA kit. Just in case, because I think today, George, we might be having a baby here.
Okay.
Let's
So,
wait until we get some read all that. Right. How you going there, George?
I think it's coming.
You think it's coming? All right, Ali. I think we're about to have a baby. So just reassure Mum and make sure everything's okay on that end. All right. All right. When you get your next contraction, I'm going to want you to push. All right.
Okay.
As hard as you can, and I'm going to put some pressure on the baby's head as it's coming out.
Okay.
Just to help prevent tearing.
Come on, George, you can do it.
Ah.
Keep going. Keep pushing. You can do it, okay? Keep going.
Keep going.
Keep going. Keep pushing.
All right. And I'm supporting the head and the shoulders.
okay.
All right, take
Just
a breather.
breathe.
And on your next contraction, I'm going to want you to push again, okay?
Okay.
Baby's head's out. So you're doing really, really well.
You're nearly
Alright,
there, okay?
push.
Keep pushing. Keep
Push.
pushing. Keep
Alright.
pushing. Keep going. You can do this. Yeah.
Alright, baby's born. Congratulations. That's a little
Yay.
boy.
Oh.
Okay, so if we just move that blanket, Ellie, and just put baby on mum, we'll just do some stimulation.
Yeah.
The cord wasn't around the neck. I didn't see any signs of that, so I wasn't going to worry about that. Could you just tell me the time? I'm just looking on your watch and write down the
Yes.
time of birth. I'm just going to wipe around baby's nose as well. And keep stimulating baby. And at this point, I'll do an APGAR while I'm doing some, once I've set up baby and we can do some skin to skin. Alright. So I'll just put baby on your skin, alright?
We'll keep you guys both warm, eh?
We'll wrap baby up and we'll put a towel on baby.
You warm there, Mum?
And we'll also put
Yeah.
a hat on. We're going to do some decent amount of time of stimulation, so I'll keep doing that. And once I've done that, we'll do an APGAR. An APGAR is just a little test to see how well baby's doing, okay? Awesome. So I can hear that baby's crying, so that's good. I'll give baby a 2 for a nice vigorous cry. Baby's not overly active, so I'll give baby a 1 for that. He's definitely grimacing a fair bit over there, so I'll give baby a 2. Looks nice and centrally pink, but a little bit peripherally blue, so we'll give baby a 1 for that. And then I'll just take a quick pulse. And it sounds really nice and fast. It sounds above 100, so we'll definitely give baby a 2 for that. So baby's looking really, really good, okay? So that's awesome. So I'm just going to get you to reassess mum.
Yeah.
We'll just take some more vital signs on you, George, if that's okay.
Okay.
And then we'll just see how baby's going. Once we've reassessed you, we can...
Is it okay if I put this around your arm?
Yep.
Does BP sound good?
Yeah.
Awesome.
It's about the same as it was before.
Awesome.
I'll just quickly do a heart rate as well.
Great. Looks like everything's going well, all right? Would you like anyone to notify your husband of the birth?
Yeah. If you guys
Alright.
can do that, feel
Cool.
free.
I'll get Ellie to do that once she's finished.
I'll go over that now.
And maybe just start getting the ambulance ready, warm it
Yeah,
up,
sure.
and the heater's on. Thank you. All right. So with with the cord, I know normally the dad likes to cut the cord. Obviously he's not here at the moment, and I don't want the cord being attached to baby for too long.
Yep.
Is it all right if one of us does it, or would you like to do it?
Oh, you guys can do it.
Okay, awesome. All right. So I'm just gonna uncover baby a little bit. We'll just get that cord. So I'm just going to clamp the cord. I'm going to clamp it 10 centimetres from baby, and then I'm also going to clamp it 5 centimetres from the first clamp. I would normally just put them on and clamp them, but since they can't be unclamped and we don't have enough resources, I'm not going to put them on. Once they're clamped and the cord stop pulsating, I'll just do a nice one smooth motion to cut it with our scissors, and we can give baby to mum. We can do some skin to skin. All right, here we go, mum. So if you just put baby on your skin, okay?
Hey, my skin.
Good job, good job. So at this point, we're just going to put you in the ambulance, okay? And then we'll get you to hospital as soon as we can,
Okay.
and they can check you out there. We might have to deliver the placenta in the ambulance.
Okay.
Awesome. So we are now in the ambulance. It's nice and warm. We've made sure it's a good environment for baby. And we're just observing for signs that the placenta is going to come out. So I can see that George is starting to get a little bit of discomfort. So if you're ready, George, do you think that that placenta might be coming out?
It's coming.
Okay, that's awesome. Ellie, could you grab the yellow biohazard bag? We've pulled over on the side of the road. And we'll just do the placenta. So when you feel like you're getting some cramps, just take a nice big push, alright? Awesome. Keep going.
Keep going. You can do it. Keep going.
Keep going. I'm not going to pull on the cord. I'm just going to support it. Coming.
Keep going. You can do it.
Good job. Keep going. Keep going. Keep going. Keep going.
Keep going. You can do it.
It's almost
Just
out.
another push.
It's
Just
almost out.
another
Good
push.
job.
Yay.
Alright, it's now.
You did it.
It looks to. I'll cover mum back up. It looks to be nice and intact. Can't see anything wrong. Is there anything you want done with your placenta?
There's a tray I'm going to bury it under at home.
Okay, so I'm really sorry, but I'm going to have to put it in like a yellow
That's okay.
bag.
Yep.
So put it in there. And then we'll label it and make sure at hospital it's returned to you
Yep.
once they've checked it out, alright? I'm just going to do another quick APGAR of baby, if you don't mind. I'll just make sure baby's okay. So I can see from here that Baby's nice and active. I'll give baby a 2 for that. Definitely grimacing, so another 2. Baby looks nice and pink, so I'll come around and check the peripheries. So baby looks nice and pink all over, so I'll give baby a 2 for that. I'll take baby's pulse. Alright. Sounds really nice and fast, so that's another 2. So I'm really, really happy with that. And baby appears really well and is breathing well and crying, so that's a full APGAR of 10. So that's really good. Now that we've delivered the placenta, I just make sure that mum's not bleeding, anything like that. And I can't see any signs of massive hemorrhage, and if we had any signs, I think we just have to speed off to hospital. And from here, we'll just document everything and carry on.